My name is Lobban, and today I am here to discuss shock. So, shock is the inadequate perfusion of the body tissues and organs, and the inadequate waste removal of carbon dioxide. So, shock normally affects the cardiovascular system, also the respiratory system. The cardiovascular system consists of three parts. So, you have the pump, which is the heart. You have the container, which is the blood vessel or pipes. And you have the content of it, which is the blood. So, shock normally affect one or both of these, or more than one of the system, of the parts of the cardiovascular system. So, there is four types of shock. So, at first you have the cardiogenic shock, which directly affects the heart. Then you have the obstructive shock, which is a blockage in the cardiovascular system. Distributive shock, which affects the tone of the blood vessel, the wide scale vasodilation. And you have the hemorrhagic shock, or no, hypovolemic shock, which affects the volume of the circulatory system. So first I'm going to discuss cardiogenic shock, which is normally caused by injury or disease that affects the heart directly. Most time it's like a heart attack. After heart attack, cardiogenic shock occur. So the heart loses its ability to function properly. So it's not loading properly and it's not pumping enough volume around the body to adequately supply the body with nutrients and oxygen. Next, you have the obstructive shock, which has three main types of shock. The first, you have cardiac tamponade, which normally caused by an injury to the heart, a blunt force trauma, mainly. So, blood seeps into the parietal space, which compress the heart, preventing it from loading properly. So, symptoms of car- um, cardiac tamponade are normally referred to as neck triage, which is muffled heart sound, jugular vein distension, and systolic and diastolic blood pressure merging together, causing a low pulse pressure. Next, you have pulmonary embolism, which is a blockage that normally occurs in the lungs of the artery of the lungs. So a blood clot forms somewhere is maybe in the lower extremity and rise up through the circulatory system and causes a block in the lung, which prevent oxygenated blood from the lungs to travel to the heart and affect the cardiovascular system and lead to shock. Then you have tension pneumothorax, which often caused by a blunt force trauma or penetrating injury. So air and fluid sometimes seep into the pleural space between the lung and the chest wall and compress the lungs and pushing in the injured side, the media still on towards the uninjured side, and so doing causing compressed circulation. So it normally lead to jugular vein distension and so on. So it causes inadequate perfusion, which is basically shock. Next, you have the distributive shock. First, you have septic shock, which is a bacterial infection that generates poison or toxin that affects the permeability of the blood vessels. So fluid leak from the blood vessels and sometimes leak into the respiratory tract, which affects breathing also. It also causes widespread vasodilation, so blood pools within the cardiovascular system, and hence the body is not properly perfused. Next, you have psychogenic shock, which often comes from a sudden situation like someone frightened or receives bad news. So you have widespread vasodilation, blood pools in the extremities and so on, and enough blood not traveling towards the brain, so it often leads to fainting or syncope. Now, neurogenic shock, which is often caused by an injury to the upper cervical column. So below the column, below the injury, often loss in muscle tone of the blood vessels, which lead to widespread vasodilation. So below the injury site, the body normally stay warm, no sweating, and lose control of the lower body. Septic, cyclone, you know. And you have anaphylactic shock, which is a severe allergic reaction that's normally caused from something you're allergic to, such as medication, food, pollens, and so on, often resulting in hives and urticaria and so on, swelling to your airway, which often cause short of breath and widespread vasodilation, so the blood pools and prevent adequate, adequate um, insufficient amount of nutrients and oxygen to the body. So next you have the hypovolemic shock, which is non-hemorrhagic and hemorrhagic. So in the hemorrhagic, you normally lose blood, which is caused by a traumatic injury. So there is not enough volume in the circulatory system to supply the body. And you have the non-hemorrhagic, which often caused from vomiting, diarrhea, burns, or crush injury. You lose plasma from circulatory system, and hence you don't have enough. And there's also two stages of shock. So you have the compensated stage and the decompensated stage. So the body have a system in which when you lose blood or there's a problem, it's trying to maintain homeostasis for a while. So when the body is not able to maintain homeostasis, it goes into decompensated shock. Decompensated shock is a very serious state of shock in which blood pressure begins to fall and breathing slow, which can lead to death. Here ends my presentation on shock. Thank you.